Okay, I hope everybody's having a wonderful break. Nice spring break, very beautiful outside. Been raining a lot lately, but you know it happens. Make the snow go away. Alright, so I wanted to go over a little bit about cardiovascular system because I know if you don't spend a lot of time on it, it can easily get away and out of your mind. So I want to spend a little bit of time on that because I know we're on a week break before you guys have a big test. So going over the blood flow of the heart in the cardiovascular system. The best way to understand heart failure is understand how the blood flows throughout this intrinsic system, I guess. So pretend this is your heart. Venous blood flows towards the heart. Arterial blood flows away from the heart. So venous blood flows into the heart, the right side of the heart. It is then pumped out into the pulmonary system. The pulmonary system takes that blood, diffuses it with oxygen, unloads CO2, picks up O2. That blood is then carried into the left side of the heart via the pulmonary, and then it is then pumped out the aorta, and then that oxygen blood, that hemoglobin, is able to drop off that oxygen to different sites of the body, different tissues, it's called oxygen perfusion. Your body needs it to thrively survive. So, heart failure, what is happening? Flow of the blood and oxygen diffusion. Looking at left side heart failure, usually that tends to happen before the right side failure kicks in. Usually in turn with left side. It's due to the lack of the left ventricle, due to the lack of oxygen in the left vent. The left vent enlarges with stretched tissues rather than functional tissues. As a result, you have an increase in heart rate, cool skin, tingling extremities, decrease in cardiac output, and decreased in oxygen perfusion to the tissues. Because what's happening, that oxygenated blood is unable to be pumped out the left vent and into your body. Diminished left vent function, blood backs up into the pulmonary veins to cause dyspnea on exertion, confusion, dizziness, orthostatic hypotension, decrease in peripheral pulses, and pressure cyanosis. Cyanosis is that blue looking like almost skin on your skin due to the lack of oxygen being able to be perfused throughout the body. You're going to have an increase in rising capillary pressure in the lungs, causing sodium and water to be pushed out into the interstitial space, causing pulmonary edema. So that backup of blood flow from the left vent is being backed up into the pulmonary system, causing an increase in fluid excretion, resulting in pulmonary edema. So that would be the left side heart failure, basically. The oxygenated blood isn't properly being pumped out of the left heart and into the system. Pardon me real quick here. Okay. The right vent may now become stressed because of this. It's pumping against greater pulmonary vascular resistance and left ventricle pressure. This results with the right vent also enlarging with the formation of stretched tissue rather than functional tissue. Blood is pooling in the right ventricle and the left atrium. The backed up blood causes pressure and congestion in the vena cava. Remember, the blood that's entering the right heart is all coming from different parts of your body. It's deoxygenated blood. It's coming basically from the systemic area here, pumped out the right heart into the pulmonary, left heart, back out to the body. So what's happening is the backed up blood in the vena cava, I guess you could say, it's being backed up from the right heart, almost not even able to get into the pulmonary system. This is causing pressure and congestion in the vena cava and the systemic circulation. So pressure and congestion is going to be all happening in this area all throughout the body due to the lack of inadequate blood flow into the heart, into the pulmonary. This is going to cause an increase in venous pressure. The liver and spleen, usually affected as a result of right heart failure, they may become engorged, and the function of which both of them could be impaired. Due to this, patient may develop anorexia, nausea, abdominal pain, a palpable spleen or liver, and causing weakness and fatigue. Now, the rising capillary pressure that's happening in your capillaries due to the increased pressure of the vena cava, and all that back up the blood flow, you're going to have a bunch of increased pressures going on in your body. A rising capillary pressure forces the fluid from the capillaries into the interstitial space, causing edema, causing tissue edema, especially in the lower abdomen, resulting in ascites, which is usually a complication due to right heart failure. Again, patient may experience weight gain due to this, pitting edema and nocturia, frequent urination. So looking at all this again, the blood comes from the venous system to the right heart, pumped into the pulmonary. Pulmonary then takes that, unloads CO2, picks up O2 during inhalation and exhalation. That blood is then taken from the pulmonary into the left vent, or into the left heart. Specifically then pumped out the aorta, and then adequately oxygen is able to perfuse the tissues. So with right heart, or with heart failure in general, you're not able to, in a left-sided case, the blood is unable to come from the pulmonary and be adequately pumped out the aorta to result in proper tissue oxygenation. In right heart failure, the blood is being backed up from the right heart, backed up from the venous system. Blood then backs up. You have a lot of capillary edema going on due to this, the increase in pressure. So basically, the blood backs up from that pulmonary area. Pardon me here. Blood backs up from that pulmonary area and is unable to adequately go through that and then to the left system. So the result of the left heart failure ends up becoming the start of the right heart failure, being backed up from that, and then inadequate blood flow from the systemic parts of your body. So definitely look at left and right heart failure, differences between the two, some of the clinical manifestations of both. With left side, you're looking at more pulmonary things. Right side, you're looking at more systemic type things, but both of them coincide with one another, and they both are the result of many different signs and symptoms. Another quick thing I think I wanted to go over here. Note that when the test comes and you've got essays that you're looking at, the respiratory, circulatory, and I guess edema in general all can coincide with each other in certain complications. So understand how each one relates with one another, and that way if essay comes about where each of these concepts are included, you'd be able to properly look at and attack that essay, I guess you'd say. Cor pulmonale is kind of something I want to look over. I kind of lost the page though I was looking at. Real quick here. Oh. maybe I can't find it, but anyway, go over cor pulmonale. Oh, here we go. Treating cor pulmonale. Understanding it. Know that's a pulmonary disorder. Anatomic alterations in the pulmonary blood vessels and functional alterations in the lungs. Increased pulmonary vascular resistance resulting in pulmonary hypertension. You have then right ventricular hypertrophy, cor pulmonale, right-sided heart failure. And know the causes of what can be caused to induce left and right-sided heart failure. A lot of times you're looking at myocardial infarction, where maybe an emboli breaks off in an artery and it's carried into the vasculature of the circulatory of the cardio or pulmonary system, cuts off circulation, inadequate oxygen blood supply, and you're looking at left or right side heart failure in turn. Then again, other complications such as plaque formations. Know this stuff, it'll help you out a lot when test comes. Hope this was helpful. Hope everybody enjoys the rest of their break. Wednesday, I hope to have some kind of PowerPoint up before then. If not, we'll go over it and then go over some essays in class. Alright, hope everybody has a good break. See you later. Sean P. Hall, signing off.